If you think walking 30 minutes a day is enough to keep you out of a nursing home, you are making a dangerous mistake. Don't get me wrong, walking is fantastic for your heart and lungs. But walking misses the single most critical physical skill required for independence, and that is power. Today, I'm going to show you one chair exercise that research suggests is superior to walking for preserving your ability to live alone. It's not just an exercise, it's a clinical predictor of how long you will live and whether you will suffer a serious fall. However, there is a common mistake people make when doing this that actually destroys their knees. We will fix that today. I see patients with great cardiovascular health who still end up dependent on care because they lost the strength to stand up. Let's fix your trajectory right now. Before we start training, we need to test your current status. This is the exact test used in geriatrics to determine fall risk. It is called the 5 times sit-to-stand test. Here is the setup. Use a standard height chair, roughly 17 inches or 43 centimeters. Sit with your arms crossed over your chest. Your goal is to stand up fully and sit back down 5 times as fast as possible. Here is the metric. If this takes you longer than 12 seconds, you are clinically classified as a fall risk. If you cannot do it without using your hands, you are already in the frailty zone. This isn't about looking fit, it is about the mechanical ability to get off a toilet or get out of a deep chair without help. If you failed that test, or if you had to use your arms, the next few minutes are the most important minutes of your day. Why does this happen to people who walk daily? Walking is a low-intensity endurance activity. It utilizes type 1 or slow-twitch muscle fibers. However, aging causes a preferential loss of type 2 or fast-twitch fibers, which are the ones responsible for power and reaction time. Walking simply does not stimulate these fibers enough to stop the decline. We don't just think this exercise works, we have the data. Let's look at 3 specific pieces of evidence. First, a randomized clinical trial published in Age and Aging looked specifically at people over 80 years old living at home. They had one group do daily repeated sit-to-stands. The result was a statistically significant improvement in balance over just 6 weeks. These were not athletes, these were real seniors in their 80s. Second, another study followed adults aged 60 to 90 for an 8-week resistance program. They found that sit-to-stand performance changed the strategy of movement. Participants became measurably faster and mechanically more efficient. They literally retrained their brains and bodies to move younger. And third, a scoping review of the literature confirms that while study designs vary, sit-to-stand interventions consistently show improvements in motor function. It is the high-yield investment for your lower body. Now, we must master the technique. Doing this wrong causes knee pain. Doing it right cures it. For the setup, use a sturdy chair placed against a wall so it doesn't slide. Your feet should be shoulder-width apart and slightly turned out. Your knees must track over your toes and not collapse inward. Now for the movement. First is the hinge. This is the secret. Do not just drop straight down. Hinge at your hips, bringing your torso forward. Your nose should be over your toes. Next is the drive. Push through your heels, not your toes. Squeeze your glutes to stand fully upright. Lock the hips at the top. Finally, the descent. This is crucial as this is where the strength is built. Lower yourself for a count of 3 seconds. Do not plop down. The most dangerous mistake is initiating the movement by shoving your knees forward. This shears the knee joint. Instead, think about sitting back into a chair behind you. The hips move first, not the knees. I hear the objection constantly. My knees hurt, I can't do this. Actually, you likely have knee pain because you lack the glute strength to support the joint. If you cannot do a full rep, or if it hurts, we scale it. We do not stop. Here is the modification. Add firm cushions or books to the chair to raise the height. The rule is to start at a height where you can perform the movement with zero pain using the technique we just learned. For progression, as you get stronger over 4 to 6 weeks, remove one layer of cushion. Slowly lower the target until you are at standard chair height. This is called progressive overload. How often should you do this? We treat exercise like medication. The dose matters. Phase 1 is the builder phase. If you failed the 12-second test, your frequency should be 5 to 6 days per week. Aim for 3 sets of 10 repetitions, resting for 60 to 90 seconds between sets. We do this so often because older muscle requires more frequent stimulation to signal growth than younger muscle. Phase 2 is maintenance. Once you pass the test, drop the frequency to 3 days per week. Keep doing 3 sets of 10 repetitions. Your goal here is to focus on speed and power on the way up and control on the way down. This entire routine takes less than 10 minutes. It replaces the need for a leg press machine and is safer than heavy barbell squats for this demographic. Beyond independence, this is a metabolic engine. Because the quadriceps and glutes are the largest muscle groups in the body, engaging them creates a massive demand for oxygen. If you perform these sets with minimal rest, you are essentially doing high-intensity interval training. This improves your VO2 max and insulin sensitivity. You are burning significantly more calories per minute than walking, and you are building the lean tissue that keeps your metabolism active. Furthermore, unlike walking, this is a closed kinetic chain exercise. It stabilizes the joints and improves bone density in the hips and spine, which are the 2 areas most susceptible to osteoporotic fractures. Walking is essential, but it is not a strength builder. The science is clear. Specifically targeting the sit-to-stand pattern is the most effective way to reverse frailty and ensure you stay in your own home. Your homework is to test yourself today. If you fail the 12-second standard, start the protocol tomorrow. Do not accept decline as a normal part of aging. It is a choice. If you found this helpful, please subscribe and share this video with someone you care about who needs to stay independent. I'll see you in the next video.